And good afternoon, everybody. Thank you for taking the time to join us on this February 19th, 2025. We are in the midst of Heart Month, and today we are here from the Hypertrophic Cardiomyopathy Association with one of our partner organizations, Northwestern, and Dr. Dominic Fullenkamp, who is going to be providing some information on the disease states that we're speaking of today. Due to some scheduling conflicts, we have video testimony for you from members of the residents of the state of Illinois who are affected by hypertrophic cardiomyopathy. So we're going to be hearing those videos shortly. Also with me is Julie Russo, our legislative lead here at the Hypertrophic Cardiomyopathy Association, and Julie will be available for scheduling additional appointments and follow-up. So without further ado, let me do a screen share and make sure I am sharing sound and optimizing for video. Okay, because we don't normally have videos. Hello again. My name is Lisa Salberg. I'm the founder and CEO of the HCMA, and I'm going to be moderating today. And we are going to go over a number of issues, including who we are as an organization, what the disease states are that we're looking for. So this is hypertrophic cardiomyopathy and beyond. I'm going to talk about some of the core elements of the Children's Cardiac Safety Act. You'll hear from three different individuals living in Illinois with hypertrophic cardiomyopathy. And then we're going to wrap it up with a call to action and a story about how you could have, we all could have acted in time to save the life of a young lady named Jillian. So please stick with us for this entire adventure. The HCMA is a 501c3 nonprofit organization. We seek to be the preeminent organization improving the lives of those with HCM and thick heart muscle disorders while preventing untimely deaths and advancing global understanding. So we do this through a number of mechanisms, including our Center of Excellence programs, which I'm proud to say Illinois has a wonderful Center of Excellence over at Northwestern. So you're going to be hearing from a member of that team today. Additionally, we provide education for patients, clinicians, and the community at large about HCM and all thick heart muscle disorders. And we hope that we can help to aid in the discovery of new treatments for these patients. So about 2 years ago, we've created a report card state by state, and we are seeking that every state hope to accomplish an A from the Hypertrophic Cardiomyopathy Association's report card. So we have a number of elements that we're looking at when we evaluate a state for our report card. Thank you very much to the state of Illinois for appreciating and recognizing HCM Awareness Day. You have some excellent state laws related to AED placement, CPR requirements for students, Good Samaritan coverage. There are some other issues that we could potentially work on beyond those that we speak of today, and they have to do with the safe delivery of medications, as well as our continuing efforts to ensure that patients have access to high quality drugs regularly. So copay accumulators, step therapy laws, we have to keep up with what's going on in the community. So we encourage you to do so and stay in touch with us, and we'll let you know what's going on out there. Additionally, we have the elements of the Children's Cardiac Safety Act, which are in this other tab over here, which are not active on my screen. I'm sorry. But what we are looking for, I will go over in the next couple of slides, and they have to do with making sure that we are asking questions in every well child examination to ensure that children's hearts have the attention that they should get. We have been really pleased with our response this year to HCM Awareness Day resolutions, proclamations, and laws. As you can see, Illinois is on our list here, and eventually, hopefully, we'll get every state, but we're looking pretty good this year. So thank you to all who have participated in this initiative. I am going to flip to Dr. Dominic Bellenkamp from our program over at Northwestern. And Dominic is going to talk to you about some of the diseases that can cause a family to have problems, HCM and otherwise. And I'm handing the microphone over to you, Dr. Fullenkamp.
Thank you very much, Lisa. It's really a pleasure to be here. So hypertrophic cardiomyopathy is a disease of abnormal heart muscle thickening. This can cause the heart to become stiffer and leave less room for blood to leave the heart and fill in the heart. By the numbers, hypertrophic cardiomyopathy is the most common inherited cardiovascular disorder. It's been estimated up to 1 in 100 and 250 people have hypertrophic cardiomyopathy. In the United States, up to 1.3 million people have hypertrophic cardiomyopathy. However, this is a highly underdiagnosed disease, and probably only about 150,000 patients have been diagnosed of the 1.3 million patients that likely have hypertrophic cardiomyopathy. This is the disease that when you think about a basketball player, a young basketball player that dies suddenly on the basketball court, this is the most commonly implicated disease. There is also a risk of heart failure and stroke at any age. However, hypertrophic cardiomyopathy is one of many genetic heart diseases that can run in families. And we'll go to the next slide. These diseases include arrhythmic diseases like arrhythmogenic right ventricular cardiomyopathy, long and short QT syndrome, Brugada syndrome, catecholaminergic polymorphic ventricular tachycardia, things like dilated cardiomyopathy, as well as other congenital forms of heart disease. We've estimated that between 137,000 and 400,000 Illinois residents are affected by these diseases. And so it really is a major issue, I think, for the state of Illinois. Let's go to the next slide. Hypertrophic cardiomyopathy, as well as other genetic heart diseases, are sometimes diagnosed based on just a family history of the disease. Sometimes it's a heart murmur. And sometimes it's symptoms like shortness of breath, palpitations, chest pain, tiredness, brain fog, passing out episodes, muscle symptoms. And sometimes it's really no symptoms at all. And I think this is one of the things that we really think is important, is that probably the vast majority of hypertrophic cardiomyopathy patients don't have symptoms. So next slide. So in terms of hypertrophic cardiomyopathy, the complications that can occur, these are things like sudden cardiac arrest, arrhythmias, either like atrial fibrillation, other life-limiting symptoms, shortness of breath on exertion, infections of heart valves, progression of heart failure symptoms, and even the need for heart transplant. And I think one of the big things is, while these are the complications, early treatment really does make a big difference in hypertrophic cardiomyopathy and other forms of genetic heart disease. Go to the next slide. What are early treatments and what are big areas where we can make a big difference? There are devices like implantable cardiac defibrillators. These are devices that can shock the heart out of life-threatening abnormal heart rhythms at any time that they occur. These can prevent sudden cardiac death. This is very important in things like hypertrophic cardiomyopathy for patients that are at elevated risk of these outcomes. Heart failure is early medical management and treatment of heart failure, we think makes a big difference in terms of preventing the progression of the disease. There are also treatments like surgery and transplant for certain stages of disease. And then atrial fibrillation and stroke. These are abnormal heart rhythms that can lead to strokes. And we think detection of these abnormal heart rhythms early make a big difference because we can put people on medical therapy to both treat the abnormal heart rhythm and dramatically reduce the risk of stroke. And then I think one of the most important jobs that I do every day in my clinic is helping patients and their families to understand what their risk is of dying or of developing a genetic form of heart disease. And so hypertrophic cardiomyopathy, as well as most other forms of genetic heart disease, is passed on in what's called an autosomal dominant fashion. The basics are that you get one copy of gene from mom and one copy from dad. And it only takes one bad copy of a gene to cause genetic forms of heart disease. And so what we can do is construct a family tree, or what's called a pedigree, and we can start testing. If we can identify a gene that's causing the disease, we can start testing the patient's family members and figure out which family members are at risk and which family members aren't. And we think that early diagnosis and treatment of those family members makes a huge difference in terms of their long-term outcomes.
Fantastic. Thank you for that overview. In the Children's Cardiac Safety Act, we are seeking state level initiatives and law changes that would include cardiac questions be added to the well child examination for all children under the age of 19. We would like to improve professional development for healthcare providers with an online training system so that these clinicians can understand the diseases that they're looking for. I do believe it is important to explain here that many of these diseases were thought to be ultra rare even as little as 10 years ago. So getting a better understanding of the reality and the prevalence of the diseases that we're looking for is important to our healthcare provider ecosystem. So the education is an integral part of making sure that we give them all of the tools to find the patients who are at risk. We seek to improve the student athlete pre-participation physical examination to include family education about signs and symptoms linked to cardiac conditions. We would again like to improve the ability of healthcare providers to identify both the child and the family at risk for cardiac genetic disorders. And we are always looking for innovative programs to improve AED coverage, training, and emergency preparedness at the legislative level. So, what do we know about the Children's Cardiac Safety Act by key virtues? This is a bipartisan approach. We know that everybody has a heart, Republicans, Democrats, independents, and even those who don't vote, they have a heart. And we want to make sure all hearts are protected. We are looking for cost effective mechanisms. We're being proactive, not reactive. We know that the cost to diagnose children and families at risk is cheaper when we're asking some really well-pointed questions so that the healthcare provider can determine what the proper next step is, which test is appropriate for that individual. And we can help avert much higher costs that are related to a survival from a sudden cardiac arrest, as it can result in a neurologic injury, other physical injuries, and then you're dealing with the underlying cardiac condition and the aftermath of a potential brain injury or trauma. So that is something we don't want to see happen. We want to avoid that. We want to promote cardiac wellness in children overall, not just student athletes. If you were to look at data, and I'm more than happy to go down these rabbit holes with anybody interested in looking at the data, when you look at sudden death in athletes and the total number of deaths per year, there are an estimated 70 deaths per year in the United States. When you look at the total number of children that are dying just from hypertrophic cardiomyopathy under the age of 24, a little bit higher than the age limit on this particular initiative, you will see that 80% of those who die are not athletes and 20% are considered athletes. So looking only at student athletes is missing the mark, and we need to look at all children. We have proof of concept in the state of New Jersey, as this has been law here since 2015, and every well child examination in the state of New Jersey has used these questions to identify who needs to be referred for additional services. We had countless success stories in New Jersey where families were found earlier, referred properly, and treatment could pursue. We are happy to announce that this model legislation has been vetted through the American Heart Association, and they are on our side, and they will support these initiatives moving forward in your state. We want to improve the ability of healthcare providers to identify children and family with these cardiac genetic disorders, and we're going to need the state legislators' assistance in doing that. We've also, I will bring this article up again. So about 2 years ago, 3 years ago now, the American Academy of Pediatrics put forth an article stating that we're not doing enough to protect children's hearts in America, in this article entitled Sudden Death in the Young, Information for Primary Providers. And I will make note that Stuart Berger, who's listed here as an author, is currently at Lurie Children's Hospital and has been for the past 10 years running their cardiac program there. So shout out to Illinois on that one as well. So we've got the support of AHA. The American Academy of Pediatrics has encouraged people to find better solutions to identify children with heart disease. So we are all on the same page here. Now we're going to hear from Dr. Jan Berger, who's also patient Jan Berger and a resident of Illinois.
Hello, my name is Jan Berger. I've been a Chicago resident most of my life. Until September of 2023, I was an active, healthy healthcare executive and physician. In the summer of 2023, I went for my annual checkup, where my internist found a heart murmur she had not heard before. After a number of tests, I was diagnosed with hypertrophic cardiomyopathy, also known as HCM. Even as a physician, this is a disease I had rarely, if ever, heard about. All I knew was that people, especially athletes and children, died suddenly of this disease. I believed this diagnosis was a death sentence for me. I was happy to hear it wasn't. In all my years of practicing as a pediatrician, it was not a disease I looked at or looked for or diagnosed. I was surprised to hear it's the most common genetic heart disease with 1 in 250 people, which in the United States constitutes up to 1.3 million individuals may have this disease. Unfortunately, 80% of them don't know they have the condition or the gene. I'm lucky because my level of HCM is not severe or end stage, but it has changed my life. I have good days and bad days in regard to severe fatigue. I'm careful about my exercise and my activities. I'm always watching for dizziness, racing heart, other heart symptoms, or my blood pressure and my heart rate. I have to be careful what I eat, in fact, very careful. All these things put me at risk for sudden cardiac death or a sudden cardiac event or make my heart failure worse. All these things also affect my work, my family, and my friends. There are 3 things that I would like you and others to learn from my experience. Screening and diagnosis of HCM is really important. All children should be screened for family history and signs and symptoms of the disease. This can be done with 4 simple questions. These questions have all been agreed upon by the American Heart Association, American College of Cardiology, and the American Academy of Pediatrics. It is a very low-cost, simple way to identify the condition. Number 2, we need healthcare professionals to educate themselves about the condition. I'm not unusual in my lack of knowledge or even existence of HCM. And number 3, emergency action plans and AED availability in schools, playing fields, and public facilities can save lives. We need to keep families intact. HCM and cardiac disease are the #1 killers outside of accidents for children. Let's save our children. Thank you for your time today.
And next up, we're going to hear from 2 sisters.
Hello, my name is
Oh.
Jan.
2 sisters who made some news recently in the state of Illinois. Both of them are longtime clients of the HCMA. And the elder sister and I share something in common. And then we got the younger sister involved too. Here they are.
Ready to start? All right. Hi, my name is Abby Cannon, and I live in Roselle, Illinois. I was diagnosed with HCM when I was 34 years old. I never had any idea that I had any type of heart disease or any problem with my heart. And unfortunately, my prognosis was pretty bad from the start. My heart was covered in scar. It was very thick. It was not able to do its job. And I ended up, going on some medicines that really weren't helpful. I was sick for over 5 years, very sick, and ended up needing to have a heart transplant. In 2017 is when my heart transplant was. And so this is really important to me, the Child Cardiac Safety Act, because I know that my children, my desire is to know if this is something that they may have. They get checked every year, but there's a lot of families out there that have no clue that they even, have HCM. And this is my sister.
Hi, I'm Meredith Everhart. I'm also live in Roselle, Illinois. I was recently transplanted in January of last year, 2024. I first started having symptoms in my 20s. There was some symptoms growing up, but nothing that was ever extreme enough for me to think that there was something wrong with my heart. But there was never any testing done. And I was misdiagnosed in my 20s for several years as unspecified chest pain, leading up to my diagnosis when I was, I believe, 34 34 years old, I was finally diagnosed with HCM. A few years later, my heart got worse and I ended up in heart failure, and I was put on the transplant list. And 9 months I was at home and was finally able to get a heart transplant. Had I been diagnosed earlier, had I been diagnosed as a child, things could have ended up a lot different for me. I could have had taken medications, different precautions, things that could have changed a lot. So I also am an advocate of this change to happen.
The really impressive thing about these family stories is when Abby went to transplant, it was 7 years. It was 7 years from her diagnosis, I believe, was to transplant, and then her sister transplanted 7 years after her, and her sister are 7 years apart in age. So there's something about genetics. So why is it important to understand family stories and how these diseases can travel through families? This is a story of a young lady named Jillian Blair, who's located here in the bottom picture, cuddling the dog. Her cousin was diagnosed with HCM back in 2005, but the family was unaware that there was a genetic connection, and in fact, were given false information that it is a male-to-male penetrance disease. So over time, the uncle ends up getting diagnosed with some heart problems, has surgery, dies after his surgery. The nephew goes back and gets gene testing, finds the gene, but doesn't know exactly what to do with that information. Mom and aunt end up with atrial fibrillation, still not putting two and two together. And then 3 years ago, just around this time, a murmur was detected in Jillian's family well child examination. That echo, or that murmur that was detected, led to an echo and an EKG and an MRI to be performed in March of 22, as well as genetic testing being sent out. There was clear-cut HCM. It was really a question of getting this family ready for the therapies that would come next. But they never got there because the day the genetic tests came back, which were April 21st, 2022, Jillian came home from school. Her mom informed her of the test results. She said, okay, we'll do what we got to do. She ran upstairs to get dressed for her part-time job, and she went into cardiac arrest and died on her bedroom floor. Had we gotten there a month, a year, 2 years earlier, we would have had time to get an implantable defibrillator in Jillian and get her the therapy that she needed. We didn't have enough time. If there's a victim here that needs to be kind of discussed, it's timing. Timing is everything. And if you have the time, you can live through your cardiac arrest if you prepare for it. But if you don't have time to take those precautions, unfortunately, we lose young lives like Jillian's. So we're asking for your help to save more kids like Jillian and keep families whole as long as possible. We are seeking bill sponsors for our legislation in Illinois. If you are interested in becoming a champion, we are helping you every step of the way. If you'd like to set up an appointment with Julie Russo to discuss what can we do next in your state, to look at the draft resolution, to do a comparator to state law to see where there's some room for improvement, we are here to work with you. Please schedule an appointment. We will take some questions, and as I wait to see if the Q&A box fills up, just a quick thank you to our board of directors, staff, volunteers, partners, and a big special thanks to both Jan Berger and to Abby and Mary for sharing their stories with you, and of course to Jillian and her family for sharing her memory. We wouldn't be here if it weren't for our sponsors, partners, and volunteers. And I wouldn't be here if not for an organ donor. And my angel's name was Brandy. So I encourage everybody to take a moment to learn a little bit more about organ donation. So I will look to the Q&A box. And as we are waiting to see if anybody populates the Q&A box, Julie, what's the most common question that we're getting from Hill members or staff members at the state level about the Children's Cardiac Safety Act? Are there any things that we can share that we've learned from other states that might make it a little easier for Illinois?
I think it's more of there are some components of the Children's Cardiac Safety Act that may already be in existence in a state, or that state may have something in existence, but it really does need a little bit of tweaking. I think timelines for PPE before a child starts participating in sports and everything, it seems that that's the one that they mostly want to work around because of the bandwidth that their pediatricians or their care providers have in being able to do that. So we do have a little bit of flexibility. We want to make sure that it works well for the state and that it's something that is able to be, done properly and works for the pediatricians, the care providers, and the children. We want to make sure that they can participate in sports, but we just want to make sure that they're safe. So I think that's mostly what I hear is, well, these kids still need to play sports. It's important. So
Dominic, let's talk for a minute about the importance of athletic participation for children and why it's really important to know if a kid has an underlying cardiac condition.
Yeah, I mean, I think this is like I'm an adult cardiologist, and so I don't see kids, but it's one of the most important things I do is take a family history, find out, many of my patients will have kids and, getting them in to see like a pediatric cardiologist and one that knows about hypertrophic cardiomyopathy and other genetic diseases. I find this to be like the number, like one of the number one things on my list of taking care of patients. So we don't want those outcomes. We don't want the bad outcome of the person dying suddenly and, playing their favorite sport. And we do know that like beyond that, like it's not always the sporting events that these patients die of. Those are the ones you read about in the newspaper. It's the patient like you just discussed that like died suddenly up in a room, really doing nothing. And so I think it's really like the most important thing we do is take care of families. It's the most satisfying thing about being an adult genetic, hypertrophic cardiologist is taking care of the families and getting them plugged in with people that actually have the expertise to help them.
I think we are all looking for methods to be more efficient in the utilization of healthcare, and we are seeking to facilitate that through this legislation. We are not mandating a particular test for a particular group of people based on their age. We are facilitating a conversation between family and healthcare provider about what risks live in that individual family so that they can take appropriate customized action. So I encourage you all to learn more about our initiatives. If you are interested in sponsoring, we're here to work with you. Julie, Dominic, thanks for your time today. And again, thanks to our virtual participants and thanks for all of you who took a half an hour of your afternoon to join us to learn more about our initiatives. We look forward to working with you in the state of Illinois, and we will be coming out to Illinois for the American College of Cardiology Conference in a couple of weeks. So anybody who's up towards McCormick Place, come on out and see us at ACC. And we look forward to working with all of our friends in Illinois. Again, thank you and have a great Heart Month. And don't forget to join us next Wednesday night for HCM Awareness Day, where we will be on a podcast and webinar teaching lots of people all kinds of cool things about HCM. So thanks so much and have a great day.